Being sick is not only physically challenging, but it can also be mentally challenging. While classical medicine can treat the physical symptoms of a disease, there's not always an easy answer to treating the mental stresses that accompany it. Shiri Artzi is the founder of the Medical Coaching Institute, and she joins us with more. Thanks for coming in.
Thanks for having me.
So tell us about what your company does.
Well, MCI, the Medical Coaching Institute, basically trains coaches to be medical coaches. So medical coaching is a niche within life coaching, and this niche focuses on supporting and coaching people that are coping with a medical illness or medical crisis, and or their caregivers. Can be family members or medical professional caregivers.
So how did you come up with the idea to start this institute? Where did it come from?
Wow. Well, it came from my own experience. I was diagnosed with a life-threatening illness about more than 17 years ago. And as I was going through my own journey of coping, I realized that I had amazing doctors, but there was no one there to help me create the emotional and mental resilience I needed to cope with all the challenges that an illness brought into my life. So this is what we do as medical coaches. As my condition got better, I realized there's a real need here.
Absolutely.
So I created this niche.
So what kind of response have you gotten so far by people who use this method?
Wow, we get amazing responses all over the world. We work with insurance companies, we work with hospitals, we work with charities, we work with patient advocacy associations, and we get amazing responses both from our clients, whether they're patients or caregivers, and also from doctors and medical facilities that realize the added benefit of having a patient that is supported. But not only that, today hospitals also refer staff members to get medical coaching because they realize the impact of chronic stress and burnout on staff members. Absolutely.
I mean, when you're dealing with a serious disease, there are a lot of effects that people don't really think about, that aren't necessarily physically visible. So are there any special success stories that you can tell us about?
Wow, there are a lot, and there is an issue of confidentiality that I need to be careful of. But I will say this, that we have saw that when we come to hospital, to help people prepare for medical procedures, to help people prepare for a meeting with a doctor, we see that, first of all, people experience themselves in a different way. They are very much focused on rehabilitation and what happens after. There's a shift in the state of mind, and there's an empowerment that suddenly appears, and that really changes the whole interaction and the way people react to medication. They're basically emotionally and mentally available to get the best out of the medical treatment that they're getting.
Okay, so now, if someone's interested in getting involved with what you're doing, seeking help, how can they get involved?
Well, first of all, check our website, mci-il.com. See if there's a medical coach in your area, a medical coach that speaks your language. And if you're interested to become a medical coach, well, check us out again, because we're coming to the US in November to train the first medical coaching community in the US. So that's going to be exciting.
Great. Well, thank you so much for your help.
Thank you for having me.